My name is DrRic Sigil.
And action. Hey, Jay had a... This is Kirk And action. Hey everyone, Jan had a question about pain and mood. Pain and mood seem to go together well. The problem is when pain is not addressed properly, it'll be a trigger for any kind of mood disorder. It can be a trigger in the middle of the night for an anxiety attack. It can also be a trigger after a prolonged amount of suffering for depression. So if you're on the fence or a borderline on either of the two mood disorders, this crap is going to be a problem, put you over the edge. Let's talk about what to do supplement-wise, but this is the first time you're finding me. Don't forget to hit the subscribe button down below and the alert button to find out when I do new videos. So this concept of what to do with pain. Let's treat that first, because usually if you can find supplementation that will help in both realms, and I think the biggest impact would be to the pain department. Mood can be iffy, especially, Jan, if you're on some medicines. So with regards to mood, there's a very obscure line nowadays between anxiety treatment and depression treatment. So most of the time, the docs will have you on an SSRI. That's a serotonin uptake inhibitor. And SSRI is like a Zoloft, Prozac, Paxil. Those are all common ones, and there's other ones, SNRIs, that we're not going to get into, like Effexor or Cymbalta. But bottom line is that if somebody has put you on that, then this might be, we might have to go the conservative route. If you're not on that, then I think there's some very good things that'll take care of both the joints and pain and the mood. So the first would be Sammy. This should be an unboxing, but Sammy is S-adenosylmethionine. Sammy is pretty decent. In studies, and I like Scott Shannon's work, just in case you want to read on Scott Shannon. Nice information, page 116. He spoke at the Arizona Center for Integrative Medicine at one point in time. And Andy also had a series of books. This is Integrative Psychiatry. Pretty decent as far as supplementation. Scott's book talks about a lot of supplements. And Monty's book talks about psychotherapies and other whole system approaches to mood disorder. So Sammy is pretty decent. See, it has been studied at high levels, and it has been studied to help, number one, with mood disorder, mostly depression, but I think it does help with anxiety. And believe it or not, two other things. So we have mood, mostly depression, but I think there are some small studies that show a Hamilton anxiety score, or the anxiety got better with patients using Sammy. So mood, joint pain, specifically knees and hips, so pretty good. It's not going to be that fast, but it will work nicely after a while. And then it works because of the methionine in it, S-adenosylmethionine, it works to help the liver process. So it's almost like a liver detox. The only drawback to this thing, it's pretty quick compared to, say, St. John's wort. St. John's wort is another herb that is used specifically for depression. Not great for chronic pain, but it takes a while for St. John's wort to work. And the studies with St. John's wort show it at like 900 milligrams 3 times a day. 3 times a day is a deal breaker, if you ask me. I think twice a day is a little better. And that's where this is better. It works faster. And I'm going to open this just to show. It works faster, and it's only twice a day dosing. So it's easily reduced, so you really have to have these things individually wrapped, because if you keep it exposed to air, oxygen, heat, sunlight, it will not work anymore. So that's why I like Yarrow brand. This is 400 milligrams. Yarrow brand comes in 200 and 400. I think if you start off, if you're not taking any psychiatric medicines, that's SSRIs, SNRIs, or even tricyclic, then you're safe to go ahead and start. It'll help hopefully pretty quick. I would do 400 milligrams daily for about a week to 2 weeks, and then increase to 400 milligrams twice a day thereafter. I guess one of the deal breakers could be, because this is a good company, this is $31 for 30. If you get to the twice a day dosing, that'll be $60 a month. So could be an issue, but at the price that it takes away discomfort possibly all of it, and also helps with mood. Might be good. You can stop a couple other co-pays with your medicines if you're taking multiple medicines. So pretty decent, pretty fast. Now if you're taking medications, this can interfere because S-adenosylmethionine increases serotonin in the brain. And when you're on a medicine like Prozac, Paxil, or Zoloft, that also will increase serotonin. So you might have a huge surge of serotonin, which is not good. It'll give you palpitations, a little bit of a flush, fast heart rate, mouth excessive watering. So some people refer to it as serotonin syndrome. So you have to have permission from your psychiatrist and from your primary care doctor to start this if you're on those medicines. So if you are on those medicines, this might not be a good thing. So if you ever get a holiday off of your prescriptions, there's something called a washout during that time when the doc gives you a holiday. You might want to start this. So ask him. So the other option too for short-term relief of mood, and sometimes helps with pain too, Kava Kava. Kava Kava is great. It's a Polynesian herb, sometimes twice, 3 times a day. This is really good for anxiety. The only problem with Kava Kava is that and it might not affect your serotonin like Sammy will, but Kava Kava can, if you use it for a long amount of time, screw up your liver. So especially if you take it with alcohol, and really when you have the mood and pain issues, you really shouldn't be taking alcohol. Alcohol initially is a stimulant, but after a couple of drinks, it's a depressant, and also screws up sleep. So these are my 2 choices as far as mood, if you don't have any medicines on board. If you do have medicines that you take, then the safe rule is, and again, you can find it in Scott's book, and this is just the research that I've come up with, is supplementation. And some people don't believe in supplementation, thinking that if you eat properly, that should be good enough. But I guarantee you, most Americans don't eat properly to begin with. Number 2, if you do eat properly, you have to trust that the farmers that are harvesting or growing the animals are growing them and harvesting healthily without glyphosate or any of the other pesticides. So that's on you. Not everybody can afford organic. One thing for mood, not necessarily for pain, but for mood, inositol powder. This is essentially a sugar, but studies with high dose, that's like 6 to almost 9 grams, I believe, of inositol per day divided up, does help with calming down the mood. This is great stuff. The only problem is if you're a keto practitioner, this could induce an insulin response. So it might not be great if you're a diabetic out of control, but has an innocent supplement, it's great. Put it in water and you're okay. This too, this is calm. This is magnesium. I don't really like this form of magnesium. My favorite form of magnesium is this kind of magnesium. So you've got calm that comes in a powder, then you have the calm that, not the calm, but the magnesium that comes in capsule form. This is magnesium potassium aspartate. I believe this is mostly magnesium oxide. I don't really like oxide or citrate, but it'll get the little bit of the magnesium in you. And magnesium has a calming effect. Plus, a lot of us that are stressed out or in pain, usually the stress response makes you pull magnesium out of the bone and get it ready for a contraction, muscle contraction. And then if you don't have that event of fight or flight, the magnesium gets pooped out or peed out, and then you're lacking magnesium. And also you wind up with thin bone. So taking ample sources of magnesium would be helpful. The only thing you have to watch out for with magnesium is that sometimes if your gut is very sensitive, you might be pooping a lot. So watch your poop. Magnesium L-threonate is really calming too, and that goes straight to the brain supposedly. I don't have a copy of that. So the other thing that you should be doing too is oil, omega-3. So omega-3 oil, whether it's in flaxseed or in fish, it's up to you. I just happen to take flaxseed because I've turned into a vegan vegetarian. But the only problem with flaxseed is hard to calculate the total omega-3 in here. You're assuming that the ALA will turn to omega-3 in your body. So if you're not a vegetarian vegan, then go with I think this is fish, if I'm not mistaken. Oh no, it's from coconut, sunflower, sesame, and flax. So this is also vegetarian. If you don't like this stuff, it's a little bit more pricey, then just go with the omega-3 oil from fish. And I like to maximize at 2,000 milligrams of total omega-3 twice a day. I do think omega-3 has a calming effect on the brain, especially if you are lacking or devoid of omega-3. If you're doing mostly processed food, which pain makes you hunt for is processed food, you'll just be pure omega-6. And when you have too much omega-6, not enough omega-3, inflammation. When you get omega-3 higher or equal to omega-6, anti-inflammatory. And a lot of the inflammation to the brain will irritate glial cells. Those are little cells inside the brain, and that causes inflammation. It can even be hearkened to in small studies the development of Alzheimer's disease later on. So as far as inflammation controlling joint, no question. When you have even bone on bone, there's an inflammatory reaction that does have responsiveness when you increase your omega-3 use. There's other things to do with arthritis, but I'm just in general talking. And the final thing, well, not the final thing, there's also 5-HTP. So 5-hydroxytryptophan, I don't have a copy of that or a bottle of that. 5-hydroxytryptophan is very nice for calming the brain. Also helps with sleep. It's a building block, tryptophan, a building block for serotonin. So if you're lacking serotonin and you're not taking a serotonin uptake inhibitor, 5-hydroxytryptophan at night, about 200 milligrams is what I used to do. I'm fine with my sleep at this point in time. And finally, there's essential oil. Essential oil is so innocent, but if you use enough of the relaxing essential oil, this is lavender. Lavender is very calming. You can actually drink this if you wanted to. I have it in these sandalwood beads. Sandalwood is also very calming to me. So lavender and sandalwood essential oil as often as you want. I mean, you can't overdose on that. It's an aromatherapy kind of treatment plan. It's almost like going and getting a massage every day, just that you're massaging the olfactory nerves. And the olfactory nerves in your nose go directly to the brain. So what easier way to stimulate than just having a nice sense of calming aromatherapy every day, or at least 2-3 times a day, or if anything, just at night as your head hits the pillow. So these are all great things, Jan. Hopefully we'll just be able to do one of these. Again, I'm not sure which medicines you're on. Just one more addendum. If you find that it's too confusing to use this because you're on some medicines and your doctor won't approve, or the Kava, so if you can't use these two things, then there is something that's really innocent that won't interfere with anything. And then you don't like the vitamins I just suggested. I know it's a lot of vitamins, but these two are also very nice. So these are extracts. One is passion flower. I used to use this before giving talks over at Whole Foods when I was a little bit shy with public speaking. Now I'm fine with it. So that's passion flower. The only problem with passion flower in alcohol is that when it's extracted using alcohol, it has an alcoholic taste, so a little bit of a bite. You're not going to take that much. You're just going to put it under the tongue, one dropper full, and usually it'll calm down. Average person, see how dark that is? So it's a little bit discouraging, but it does work. And then there's also Skullcap. Skullcap by Herb Farm. Really nice stuff. So Skullcap is calming to folks who suffer from anxiety. And this one is made with, it's not made with alcohol. It's the same, again, it's the same extract, kind of darkish. A little bit on the low side here, but it is based out of a glycerol, so it's more sweet. So between the two things, no interaction between passion flower here and skullcap and your medicines, and you can do a dropper full 3 to 4 times a day or at night if you're using it just to get to sleep. So both of these extracts are a nice way to get around the limitations of medicine interactions with herbs. But again, I give you a couple options. I gave you the hard and fast rule with regards to pain and mood. I've also gave you all these supplements that you should be doing anyway, but I know some people don't like taking too many supplements. And also the last ditch effort of having something on board, or at least something in your pocketbooks you can go to instead of just going straight to, say, the Xanax or another pill, a pain pill even, because they do work. There's no problems with taking prescription medicines, but there's heavy side effects. When you have a hammer that just slaps all symptoms by trying to balance your homeostasis, by forcing itself in there, it will work if you're in severe state, but when you fine tune with smaller things and smaller supplements, you won't have such a big impact. You won't have big side effects, but you will have, over the long haul, not as fast as the prescription medicines, you will have nicer accommodation, you'll have better responsiveness, and you'll have less side effects for sure. So hopefully this helps, Jan. Well, any of you other folks that are using anything for pain and mood, please put your comments down below. Otherwise, I'll see you. Oh, don't forget to subscribe. Otherwise, see you next time in the Minute Clinic.